All right, welcome everyone. Thank you so much for joining us today. It's great to have you here. Great to see people joining us from all over Boston. I see Richmond, Fort Collins, City of Berkeley. Please feel free to drop your name, where you're joining us from, and maybe one thing that gives you hope, something you're hoping to learn today. And let's get started. All right, so welcome to today's webinar, Climate Change Solutions to Promote Health and Protect Health and Promote Equity. You're joining us at the BECC virtual monthly webinars. We have an in-person conference coming up very soon, November 12th to 15th in Sacramento, California. Registration is open, either online or in person. And we have our monthly virtual component. That's where you are joining us right now. This year's theme is driving transformation, and registration, like I said, is open. So please join us. We look forward to seeing you in Sacramento in just a couple of weeks. I want to give a huge thank you to our sponsors. Thank you very much to our sponsors and supporters. You can see we have a wide range of sponsors and friends. So thank you very much. If you're interested in sponsoring, please reach out to info@becconference.org. Just a couple of brief housekeeping tips. We are in a Zoom webinar, so please stay muted during the webinar. Please use the Q&A function for questions, and we will make sure to have plenty of time for questions at the end. And then also, we love to have a lively discussion throughout, so please feel free to continue the discussion in the chat, but do use the Q&A function for questions, and we'll make sure to get to them. And with that, I'll introduce today's webinar. So I'm Miriam Axel. I'm a postdoctoral fellow here at California Institute for Energy and Environment at UC Berkeley, and a research fellow at United Nations University Institute for Water, Environment, and Health. And today's webinar, Climate Change Solutions to Protect Health and Promote Equity. We have Dr. Gail Berkowitz as the moderator. She's the Associate Director of Citrus Health at UC Berkeley, and her professional training is in public health policy, evaluation, and epidemiology. And her work is tackling some of the most critical social and environmental problems of our time, from ensuring access to quality health services, behavioral health, substance use treatment and education, and promoting financial inclusion, as well as reducing the impact of climate change, among others. Gail has extensive teaching experience and is the author of over 50 publications, and she has a bachelor's degree from Johns Hopkins University and master's and PhD public health from UC Berkeley. So thank you, Dr. Berkowitz, for moderating today's session. And our speaker is Dr. Lisa Patel. She's a clinical associate professor of pediatrics at Stanford School of Medicine and the executive director of the Medical Society Consortium on Climate and Health. And Lisa's used her extensive experience working for government, community organizations, and nonprofits to advocate for children's health priorities in the United States and beyond. She's received her undergraduate degree in biological sciences from Stanford University, her master's in environmental sciences from the Yale School of the Environment, and a medical degree from Johns Hopkins University, as well as a residency in pediatrics at UCSF. And Lisa maintains a clinical practice as a pediatric hospitalist, caring for newborns, premature infants, and children requiring hospitalization. So with that, I will turn it over to you, Lisa and Gail. Thank you so much.
Thank you so much. Should I go ahead and share screen? Okay, great. Well, thank you so much for having me. Today, I'm going to be talking about solutions to protect health and to promote equity. And what I want to start with, setting the intention, is that we used to think about, I've been studying climate change now for about 25 years. I studied it as an undergraduate, and then it felt like climate change was a distant problem in a distant place and didn't really affect us. It was an issue for the polar bears, but now we understand that climate change is profoundly an issue of here, now, and us. It is occurring in pretty much all parts of the world now in different ways. It is happening right now as opposed to something that's happening in the distant future. And it is profoundly an issue of us. I've laid out the argument before in an op-ed for the New York Times that climate change will be the greatest determinant of health for a child born today. I really like this graphic from the Lancet Countdown that really tells us what the stakes are. So every child born today will be affected by climate change. How we will respond will determine the world we live in tomorrow and will shape the health of children across the globe at every stage of their lives. And so the question we must ask ourselves is that, are we creating a world where children can merely survive, or are we crafting a world where children can thrive? There have been disasters throughout the world for those of us that have been following it. So severe drought driven by climate change put about 1 million people in Madagascar at the brink of famine. There are many island nations that will disappear in my lifetime, certainly in the lifetime of my children. Historic monsoon seasons in places like Bangladesh, India, and Pakistan. 1/3 of Pakistan, the country was underwater, I just say the words out loud, but I feel like it doesn't percolate many people's consciousness that 1/3 of a country is underwater because of climate change, monsoons, and the glacial melt that resulted. Spain, France, and Portugal, a couple of years back, battled historic and unprecedented wildfires. This past year, we saw some really terrible wildfires in places like Greece, where cultural places were burned down. And then finally, birds were dropping dead from the sky in places like India because of unprecedented wildfires. This is just what's happening in the rest of the world, let alone what's happening in our country. I just want to set the intention. We're talking about climate change. There is some amount of doom and gloom that we need to get through to understand what the problems are. But I do also want to focus this webinar on what the solutions are. So we do currently live in a world that is unsightly, polluted, isolating, harmful, and inequitable. But the climate solutions that we're talking about, the climate solutions that are within reach for us to achieve, can create a world that is beautiful, clean, connected, healthy, and just. And so really, I think the way we should be framing this problem is that we might have made some mistakes. We might have constructed societies that did result in pollution and injustice, but now we have the opportunity to learn from those mistakes and craft a better and more beautiful world. 200 major medical journals, including the New England Journal of Medicine, BMJ, and the Lancet, in an unprecedented move, this had never been done before, published the same editorial on the same day, calling climate change the greatest threat to public health in the 21st century. And what they highlighted, and I think we can all appreciate, is that we really need to try to stick to that 1.5 degree threshold. At this point, it seems like we have about 6 years to ensure that we meet that threshold. And we have made some significant policy actions to get us there, but it is not enough. We understand. So from what happened the last summer, we briefly hit 1.5. We won't know if that 1.5 was sustained. It takes a few years to know what sustained warming has been. So far, it's been 1.1. But when we hit that 1.5, we got a small taste of what this world would look like at 1.5 degrees of warming. I just want to raise this point because I think it's an important one as we're thinking about behavior change and how we get people engaged, which is that you can see often people think that, oh, nobody else really cares about climate change. This isn't an issue that resonates with folks, but actually about half the country is very concerned about climate change. And this data is actually from a couple of years ago. This data comes out every year. And so I'm going to say probably by next year, I anticipate this number to even increase because of the climate disasters we saw this past summer. But 3/4 of the country is very concerned or somewhat concerned. But then look at this gap between the number of people who are concerned and our perception of how many others are concerned. Now, if I had to posit as to why, I think it's because climate change feels like this big, overwhelming problem that we're almost too scared to say out loud because we don't know how to address. And I think this lends itself to one of the solutions, because the more we talk about it, the more others understand that we are all concerned in this, and we can build that public and political will for change. So first, I want to talk briefly about why climate change is an issue of health. There are now month-long courses that talk you through all the various ways that climate change affects health. I only have about 30 minutes, so I'm not going to go through all of it. I'm really going to focus on air pollution and extreme heat in particular. But I like this graphic from the CDC that boils it down, I think, in a very concrete way in terms of all the myriad ways that climate change affects our health. So things like severe weathers, injuries, fatality, loss of homes. We certainly saw that from things like Hurricane Katrina. Environmental degradation, if folks were following what was happening in Lake Charles, which is also in Louisiana, they got hit with one hurricane, a chemical plant exploded, a second hurricane came through, which also lends itself to the next point, which is degraded living conditions and social inequities. These are communities that tend to be minoritized communities, communities that have historically experienced poverty, so they get hit with the disaster and often don't have the resources. And there's also structural and historic racism in who gets loans, for example, to be rebuilt. So they're hit with these disasters and then often don't have the resources to rebuild their communities. Changes in vector ecology. This last summer, we saw some really concerning patterns with some possible endemic spread of things like malaria in states like Florida, for example. This follows the models that have long predicted that we're going to see a spread in terms of where vector-borne disease is going to be. And so we can anticipate a spread in things like malaria, dengue, encephalitis, hantavirus, Rift Valley fever, Lyme disease, chikungunya, and West Nile virus. Water and food supply impacts and water quality impacts. Jackson, Mississippi is another example of this. So this is a city that has a higher % Black population. This is a city where there's been historic disinvestment in terms of the water systems and the sewage systems, got hit with a lot of flooding that was probably driven by climate change and essentially broke that system. And now you have a major city in the United States without access to potable drinking water. And these are the sorts of issues and problems that we can see play out in all parts of the country as the climate disasters worsen. So first I want to talk a little bit about heat waves, because this is something that I think touches pretty much everyone, no matter what part of the country you're in. This is just a picture in India of the roads getting warped because it was so hot. I'm a pediatric hospitalist. I work in Pleasanton, Livermore. And so I was working in the hospital last Labor Day weekend when we had the heat dome effect, where the temperatures really were quite high, 116. Those were two of the worst shifts I would say that I've had in the last 5 years, and I've been practicing throughout the pandemic as well. And then this is just a heat map of what the United States looked like over this past summer. I really like this reporting that came out of the Washington Post in terms of describing what this looks like for a frontline healthcare provider. This is from the heat dome event that happened in Oregon and Washington in 2021. Their reporting was physicians raced to provide fluids to patients who arrived breathless, dizzy, and drenched in sweat. Others were brought in on stretchers, their body temperature so high, their central nervous systems had shut down. Those who could still speak told of stifling apartments and sun that made their skin sizzle. Some had tried to walk to county cooling shelters only to collapse in the blistering heat. Well, they've actually done studies on what the human body can handle in terms of heat. So a otherwise healthy adult at rest, drinking water continuously in light clothing can handle 115 degrees. And like I said, it topped 116 in places like Pleasanton, where I worked. It topped 116 in places like Oregon as well. And this, by the way, is with minimal humidity. When we get into things like wet bulb temperature, the temperature at which what we can handle, what our bodies can physiologically handle, decreases. And that's because our ability to sweat is a little bit like our sprinkler system for us, but we will only sweat if there's actually a place for our moisture to go. And so if there's too much moisture in the atmosphere, then our sweating mechanisms don't work. I think most people know this data, that we can expect that heat waves will worsen with time in terms of frequency, duration, and intensity. And why this matters in terms of health. Actually, heat is the #1 weather-related killer. This is something that most people don't actually know, because we think about weather-related disasters that most often get covered in the news, that are things like tornadoes and hurricanes. And that's because heat tends to be a silent killer. There are some places that are considering some really interesting interventions for that. So Spain, I believe they've actually done this, that they're naming their heat waves, similar to the way you would name a hurricane. And I believe a piece of legislation like this was introduced in California as well. So that we could find better ways to communicate to the public what the threat of a heat wave is. But you can see that in terms of heat and rising temperatures, we anticipate 150,000 Americans could die before the end of the century due to excessive heat caused by climate change. Those that are the most vulnerable are children, the elderly, and those experiencing poverty. When I think about vulnerability, I really like to put it into two buckets. So first, there the bucket of those who are vulnerable by physiology. So this includes the infants, the elderly, and the disabled. And then there are populations that are made vulnerable by racism and poverty. And I think a very good example of this is the 1995 heat wave in Chicago. A disproportionate number of Black Americans died during this heat wave. When the city went back and tried to do some community surveys to understand why, many community members said that they didn't feel safe so much as opening their windows because they lived in an over-policed neighborhood. So people were really willing to bake inside of their homes because of the lack of security they felt living in their neighborhoods. We also have to understand, in terms of heat and inequity, something called heat island effect. And so different places in the city experience heat in different ways. And there are some interesting studies. There's not always a correlation, but we do see a correlation in certain cities between places that have been historically redlined and how much urban tree canopy cover there is there. And it tends to be places that have been historically redlined, have been divested from, and tend to have less urban tree canopy, less access to green spaces. And we know that urban tree canopy and green spaces help to make those areas measurably cooler. The difference can be between 1 to 7 degrees. When we think about populations that are vulnerable by physiology, I like this graphic at the top that kind of just lays out the populations that we should be thinking about. And sorry, this is both physiology and as we think about social determinants of health. But first, pregnant women, pregnant individuals are at higher risk for adverse birth outcomes. And I'll tell you a little bit about that in a subsequent slide. Households living in poverty might have air conditioning, but they may not be able to even run their air conditioning. But then we also have to think about how there are parts of the United States that are not adapted for the heat. In places like the Bay Area and the Pacific Northwest, it's about 2/3 of households that even have access to air conditioning. But then we run into this issue about energy insecurity and be able to run that air conditioning in the first place. Infants in particular cannot effectively thermoregulate in the first week of life, placing them at higher risk. So now I've been through 2 heat waves. Being a pediatric hospitalist, I also care for newborns that are FQHC patients, federally qualified health center patients. So many of my patients tend to have experience housing insecurity or food insecurity. They often do not have access to air conditioning. I've learned to ask because in both of these instances, I've had 2 families that would have gone back to homes in these really high temperatures in a very dangerous situation for their infant. So we were actually able to work with social work and make sure they could stay with a family member, because I'm not going to send a family with a newborn to a cooling center to sit there all day with their brand new newborn. But it does raise the point of I think many people don't know, for example, that infants are more vulnerable, and not just in the first week of life, but they tend to be vulnerable for months moving forward because they don't have the ability to kick off a blanket or ask for hydration from formula or breast milk, for example. And then outdoor workers may not have protections in place. And we've seen some really, really tragic examples of this over the last year. There was a Kroger employee that dropped dead working in a warehouse that was too hot. There was a farm worker in Oregon that dropped dead in the field from a heat wave that resulted in a piece of legislation to better protect farmers and outdoor workers. But it took an event that extreme to lead to that policy. I remember caring for a 16-year-old who had come here unaccompanied from Mexico, who was hauling brick outdoors in 108-degree temperature, who came in with kidney damage, basically, because his muscle broke down in that extreme heat. Now, he was 16, so we were able to reverse that damage pretty quickly. But we know that outdoor workers in particular that suffer that type of repeated insult can suffer long-term damage to their kidney down the line. This was the paper I was referencing in the prior slide in terms of pregnant individual and adverse birth outcomes. So this was a paper that was looking at heat and air pollution together in terms of risks for adverse birth outcomes, and found that heat and air pollution are associated with preterm birth and low birth weight infants with marked racial disparities, particularly in Black and Hispanic women. The reasons for this are complex, but they're likely due to higher exposure to air pollution. We know that our sites of fossil fuel combustion, extraction, refinement tend to happen more often in communities of color and communities experiencing poverty, poor access to prenatal care, and toxic effects of racism on a mother's health. I don't know if folks saw recently, actually, there's a report card that came out on maternal health where the US does very poorly on this, and things like air pollution and climate change stand to make those outcomes even worse. So now we'll turn to wildfires. These pictures are from the Paradise wildfires in 2018. And when these pictures came out, I felt like they felt remarkable. Unfortunately, we've seen many such devastating and even worse devastating events, I feel like, since that time. But I just want to walk folks through some of these pictures. So for example, this picture up here on the left, this is the San Francisco skyline on a clear day. And right below it is that same skyline during the Paradise wildfires, where the air pollution and I live in San Francisco, rivaled places like New Delhi that don't have the same clean air protections in place that we do in this country. In the middle is a city that a place that just burned. It was like a bomb went off. And we've seen this type of just absolute destruction in many places, including Lahaina most recently. And then again, this felt remarkable in 2018, but we've seen many examples of this since then, that we can actually see the smoke plumes from space because the amount of acres of land that are on fire are that overwhelming. This is a picture from Greece when they had, this was actually a couple of years ago, but I was actually in Greece just this past summer when they experienced some pretty terrible wildfires, just in areas that were personally and culturally important to the Greek population. So places that they didn't expect to burn, that burned likely as a result of climate change. And then the permafrost, this is a place that should be cold, was ablaze with hundreds of wildfires in the world's coldest region. What this graph shows is basically that if carbon emissions go unabated, so I will provide some caveat to say that we have made some commitments. We passed 2 important pieces of legislation. We have a few rules through the EPA that will help us cut our carbon emissions. So we are unlikely to experience the worst scenario. But if we did nothing in terms of cutting our use of fossil fuels, we could expect a 74% increase in the frequency of wildfires by the end of the century. Certainly, we will experience some amount of increase. We've already experiencing an increase in that urban interface in terms of the number of wildfires we're seeing. And there is a possibility, depending on how we decrease our fossil fuel use and how quickly the earth warms, that wildfire pollution could be the most predominant source of air pollution we're breathing by the end of the century. Why does this matter in terms of our health? So when we burn anything, whether it's burning fossil fuels or whether a house goes up in flames, it produces these really tiny little particles that are basically the fraction of a width of a human hair. We breathe those in and it produces essentially an inflammatory cascade. We have an abundance of research that shows that chronic exposure to fossil fuel pollution results in a shorter life, stroke, heart disease, asthma, lung cancer, reduced lung function, and low birth weight. What is very concerning about wildfire smoke, and this evidence we are really just working out right now, is that we think wildfire smoke is worse. And this was a study that came out by Aguilera et al. That estimates wildfire smoke to be 10 times as harmful to children compared to other forms of air pollution. I like this graphic from the governor of Oregon that really lays out very simply, as we're thinking about who's vulnerable to wildfire smoke, it hurts children, older adults, and Oregonians with asthma and heart disease. I would put pregnant individuals in there as well. What I see as a hospital is in terms of what comes in. I tend to see more children coming in with things like pneumonia, bronchitis, and then there's increasing evidence to show the links between wildfire smoke and adverse birth outcomes, so prematurity, low birth weight, and stillbirth as well. This isn't necessarily about wildfire smoke. I just want to take a moment to talk about fossil fuel pollution itself and what it results in terms of unjust and inequitable outcomes. And so you see the statistic here that a Black child is 4 times as likely to die from asthma compared to a white child. A Hispanic child is twice as likely to die from asthma compared to a non-Hispanic white. And what are the reasons behind that? So as I mentioned, first, we start with the fact that the places where we cite are areas of extraction for fossil fuel. In California, for example, until last year, you could place a well right next to a school, right next to a home, right next to a hospital. And by the way, big oil is funding a referendum to try to get that off the books because they want to keep being able to build right next to our schools, right next to our hospitals, right next to our homes. But we understand that where we extract fossil fuels tend to happen more often in minoritized communities and communities experiencing poverty. So when a fetus is in utero, they're already experiencing that air pollution. We know that that PM 2.5 pollution that I told you about crosses the placenta because we've actually found evidence of that PM 2.5 pollution in their brains, in their lungs, and in their liver. So before they've even taken first breath, they've been exposed to that pollution. They come out and they're breathing that pollution because they also are more likely to live close to things like roads and major transportation highways. And so then they're breathing in that pollution. We interlace with that a Black family, for example, is less likely to be able to afford their asthma medication, so that if they get into trouble, they may not have that medication available to them. And then finally, we know that in medicine, because of implicit bias, that when a Black family comes to our doors for care, they are likely to receive differential care because of our unconscious and implicit bias. And then we have these completely unjust outcomes of a Black child being 4 times as likely to die from from asthma compared to a white child. These instances of environmental justice, and I know the Bay Area the best, and so I'm providing some examples for what we experience in the Bay Area, but these stories are repeated all over the country, and wherever you live, I promise you there are probably not just one, but several instances of environmental injustice that play out in the neighborhoods where you live. But just to provide some examples of how fossil fuel companies, climate change, and environmental justice interlink with each other. Richmond is a city that's just north of me, where there's a Chevron oil refinery. 30% of the population is Black, and they have had flare incidents where they're polluting the environment. There have been very high differential outcomes in terms of the percent of people there that have asthma, the percent that were affected by COVID, for example, because we have emerging evidence about the links between air pollution from fossil fuels and how you respond to COVID if you get sick. Bromic hazardous waste plant. This isn't fossil fuel, but this is hazardous waste. The city of Palo Alto had a choice on where they wanted to site their hazardous plant, and they chose an area that has always been a minoritized community, which is East Palo Alto. And then West Oakland was a previously thriving African-American community. They decided to build a freeway around it, and basically so all that pollution basically got thrown into West Oakland, and the area slowly became divested from. And so this area that was a cultural and economic hub is now an area with high rates of poverty and high rates of illness due to the freeway that is now encircling it. While this is depressing, I will say the thing that has been really amazing to see is that in every one of these places, there has been amazing community organizing for change. So within Richmond, there are a number of organizations that really fight back against Chevron. That hazardous waste plant was actually shut down by a youth movement. And in West Oakland, it's the West Oakland Environmental Indicators Project by Ms. Margaret Gordon. It is a community science program where they are collecting information and data on what that air pollution is, and have been able to make remarkable policy changes from their organizing and their advocacy. I like this quote from Hop Hopkins, where he writes, "You can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people, and you can't have disposable people without racism." Finally, I just wanted to make a note. I'm a pediatrician. I have to talk about mental health, and we can't talk about children in 2023 without talking about mental health. There are many things that I worry about climate change, but a big one is that I worry about what climate change is going to do to children's development from the moment when they're born. We understand that children need stable, thriving environments to grow and thrive, and climate change stands to disrupt that. Disasters, particularly recurrent ones like hurricanes and wildfires, will repeatedly expose children to potentially losing a caregiver that has a mental illness or exacerbation of a mental illness, housing insecurity, food insecurity. We know that early exposure to these types of what we call toxic stressors or adverse childhood events sets children up for a lifetime of poor health. And so that's why I as a pediatrician, I care about many issues, but I look at climate change as a health threat multiplier and one of the most foundational ones that's important for a lifetime of child's health. So I love this quote from Dr. Mona Hanna-Attisha. I don't know how many of you know her work. She was the pediatrician who helped to uncover the Flint lead crisis. She's writing about environmental justice as it relates to lead, but I think this also applies to climate change. And she says, the will to survive and endure can be the deciding factor between a child who overcomes adversity and thrives and a child who never makes it to adulthood. But how long can we ask people born in the wrong zip code to rise above and persevere in circumstances beyond their control, no matter how central the idea of overcoming is to our archetypal American identity? And so I think the question should be not how resilient are we or how resilient are our children, but why are we still reliant upon fossil fuels that is ruining our health when we have better solutions for energy? Okay, I did the doom and gloom. Climate change is our greatest health threat, but I also look at it as our greatest health opportunity. And I love this graphic. It's just, what if it's a big hoax and we created a better world for nothing, right? Because when we're talking about what we want to do about climate change, these are all actually pretty positive things to create a better world. Sustainability, green jobs, livable city, clean air and clean water and air, and healthy children. These are things that are worth imagining and fighting for. So now I'll turn to talking a little bit about solutions. I am very, very passionate about talking about climate change as a systemic issue. And I'm passionate about that because the fossil fuel industry has been quite good. And we actually have the receipts on this. We have the documentation on this. They ran campaigns in the 80s and 90s to make us think that we're the problem. We're causing all of this. And if we just throw our bottle into the recycling bin, we can take action to solve this. And all of that is a blatant lie. It is the fossil fuel companies that have lobbied against clean energy policy. It is the fossil fuel companies that maintain our dependence on fossil fuels. These are large policy issues, and we really need to address it as a policy and a systemic issue if we want to get to that below 1.5 degree warming. I wanted to provide a few examples of what that can look like. And so in terms of organizing and protesting for local change, so this was a great example of students giving presentation at a construction site in South Baltimore. These were student activists who formed a group, Free Your Voice, and they're fighting against air pollution and climate change within their neighborhood. And so the student protesters stopped the city from contracting with a waste incineration project for electricity that was ruining their health. And now they're going for big coal. And so I love this quote from one of the student activists that said, if the incinerator takes away a breath, how many do we need until there is nothing that's left, until the smoke clogs up and we can't feel our chest? It's important as well to join coalitions to enact statewide change. So I, as the executive director for the Medical Society Consortium on Climate and Health, we actually nurture 25 different state clinician groups. So there is Virginia Clinicians for Climate Action and Idaho Clinicians for Climate Action. Virginia is one of our oldest groups, and they have done some fantastic work in coalition with other environmental organizations and health organizations in the state. They were actually able to get the Virginia Clean Economy Act passed a few years ago. Unfortunately, that act is under threat because they've had a change in parties of who the governor is. But because they have such a strong coalition and their voice as physicians and nurses and health professionals is so resonant, they've been able to really fight back against it. It will be a continual fight to really keep the policies that have been passed, but it's just been amazing to see that when health professionals join these large coalitions and when we all work together, what we can accomplish in terms of rigorous action on climate change. This is another example of a coalition. So this was a report that I was able to write in coalition with a number of other partners. This work started for me. I'm a mother to 2 children in San Francisco Unified School District. My expertise happens to be on air pollution and wildfires. And so I started to get really concerned about, in San Francisco Unified, most of those buildings do not have HVAC systems or any preparation in place to keep that indoor air quality clean. So I had the opportunity, I got a little bit of seed funding to write this report. I used it as an opportunity to build a coalition. I was asked to write something about what a climate resilient school looked like. The more I read about it, the more I realized I knew nothing about this topic. And so rather than pretend that I did, I just started emailing everybody that I could find in the space. And I invited anybody who wanted to write this report with me. And we actually built a coalition from that. We ended up having about 20 authors on the report itself, 80 people in total that contributed to it. And what was really wonderful about writing this report in coalition with others is that once we finished this report, that was very much an academic product. We actually had then an advocacy plan to introduce a piece of legislation. So my advocacy partners, and this was Undaunted and 10 Strands, worked with a congressional representative. We got a piece of legislation introduced. It sailed through every committee. It sailed through both the House and the Senate with one single no vote. There was not a single no vote through any committee or through the House or the Senate. It got to the governor's desk and he ended up vetoing it. And he did so because we're in a deficit year and this bill was asking for $10 million. But what I learned from the experience is that when you call out to others, when you are concerned about something and you ask others for help, there are so many others that are concerned about climate change. You just have to ask. And when I asked for help on this Climate Resilient Schools report, I was joined by educators, parents, teachers, superintendents, economists, psychologists, other health professionals, because it turned out all of us was concerned about this. We just had to come up with a shared vision and a shared ask to work together on an issue. So those are just some examples I wanted to provide. Here's just a 3-step things that you can do in terms of taking national actions on climate and health. 2024 is a pivotal year. I don't mean to sound dire here, but for humanity's existence, because unfortunately, climate change has been turned into a political issue, although it should not be. And so we have leaders that are proposing honest climate solutions, and we have leaders that are denying climate change and say that their solution is going to be to continue to prop up oil industry. So this is a very pivotal year to get registered, to vote, and then to vote for elected leaders with plans as bold as the problem is big. We actually have some resources, candidate questions that you can use to press your leaders on doing more on climate change. This is from last year. We're in the process of updating it, and I'll give you a QR code at the end. We're going to have a monthly activity that you can take, nonpartisan, non-political, for what you can do to get out the vote. I also just wanted to raise up Environmental Voter Project. I think they're an amazing organization. Again, nonpartisan, non-political. They try to turn out voters that have had a historic record of showing that they care for the environment, and they call them and just ask them to vote. Not to vote for a particular candidate, but just try to turn them out to vote, turning voting into sort of a civic duty for those of us that care about the climate. The second thing, if you really care about climate change and want to do something about it, is to join a group. This work is impossible to do on your own. Not impossible, but you are unlikely to make significant change and you are unlikely to last. Sometimes this work can be very heavy, especially after this last summer. I think a number of us were experiencing a significant amount of eco-anxiety from seeing everything that was playing out around the country and even in our own backyards. And again, this gets back to the issue that climate change is a systemic problem that needs systemic solutions. So joining a group is a very powerful way to go at it rather than going at it alone. When you join these groups, it can help you learn how to write an op-ed. This is an op-ed I was actually able to write by being in a group that helped me do so. How to advocate with decision makers and do legislative visits. Those visits there on the bottom, our group came together, reached out to our decision maker, and we went all together as a group in our white coats to advocate for a specific policy. And then how to strike or mark for change. change. Those white coats, they work really well in particular when it comes to visibility for the issue. And then you can also electrify your home to be part of the solution and talk to others that you're doing it. So Rewiring America, if you're not aware, has some amazing resources. The Inflation Reduction Act passed last year, and it's basically like a $14,000 tax credit that you have sitting there that you can, up to $14,000, depending on your level of income, that you can use to electrify your home for electric vehicles. It is complicated because it depends on your household, but I found Rewiring's guide very good in terms of helping you to navigate it. I'd say it's important for you to take these actions, but even more important, back to that slide that I showed you about how many of us are concerned about climate change and our perception that others are not concerned, is to talk about it. I just think it's so important that we do these solutions, but we demonstrate to others that there are concrete actions that we can take. I know I said, just like 5 minutes ago, that it's not our individual actions that matter. They don't matter, frankly, that much when it comes to things like recycling in terms of solving the climate crisis itself, but they do matter in terms of the visibility because we do have to make these broad transitions to a clean energy economy. So when we become individual advocates to people that look to us, so whether it's our friends, our colleagues, people at our school or our church, we really have the ability to spread that change beyond just us. So this is actually a QR code. I'm one of the science moms. If you want a guide on how to talk to others about climate change as a crisis, I think this guide is a really great place to start if you haven't done this before or feel some amount of discomfort with it. And the more you do it, the easier it becomes. Now I strike up a conversation with it when I'm shopping in the grocery line or when I'm in the waiting room. If it's hot outside, I'm like, God, it's hot outside, climate change. I just find opportunities to work it in everywhere I go. And it just takes a little bit of comfort and just a little bit of guidance. So I encourage you to check out that resource. So the problem is big, but so is the opportunity for change. I encourage you to join our community and be part of the solution. There used to be 2 graphics here that have disappeared. So I might just hunt up where those links are and drop those in the chat instead. It's funny. It's showing up here, but not there. Okay, I'm going to stop share.
Thank you, Lisa. I'm just inhaling and exhaling a little bit after listening to your presentation. Your background is so impressive, especially when it comes with regard to this topic. And one wonders how you possibly have time to do something like give us your hour, given all these roles that you play. So thank you so much. So impressive. We have a few questions in the Q&A, which I'd like to get to, but I thought I would take this prerogative as a moderator and ask you a couple questions that have been on my mind, if that's all right.
Yeah, of course.
Okay. So some people have difficulty connecting the dots between climate change and health. They can see the immediate effects of climate change, assuming they believe in climate change. But, perhaps it's what they can see is the direct effect of fires or heat, floods. Next, they can see the effects of extreme heat on themselves, on people, and on health. But how do you, what words would you have for them to draw that line from climate change to health?
So when we think about, and one of the things we're really trying to move folks towards in our work at the consortium is talking specifically about fossil fuels, because I think climate change feels like this big amorphous problem that feels hard to address. But when we talk about what is causing it, then we can really talk about why it's affecting health and what the solutions are. So the burning of fossil fuels causes climate change, and the burning of fossil fuels causes air pollution, both of which are bad for our health. The pollution, those are that litany, that list that I provided in terms of shorter life, stroke, and all this, and cancer. The burning of fossil fuels also causes the release of carbon dioxide, causing climate change. Now, this link admittedly is a little bit harder, but we know as the world, I feel like the one that is easiest for people to understand is that we're just seeing dangerous heat. Heat like we haven't seen before. And I feel like heat is the one that more or less everybody's experiencing, and more or less people can grasp and understand. And then I tell really concrete stories, like in Phoenix, people fell down on the pavement because they got dizzy and sustained third-degree burns. It was so hot outside. So I'd say, I know that sometimes explaining the principle can be hard, but come up with some concrete examples, or like an athlete that collapses in the heat, for example, a baby that had to come in for rehydration because they got overbundled. I'd say the best way for us to explain the links between fossil fuel burning, the causing of climate change, and heat is to really hold those stories and tell those stories, and then work people backwards to what that chain of events is.
Thank you. That's a great suggestion to make it specific. Okay, I'm going to switch to some of the questions that our audience has asked. Tara asks, what are opportunities for federal and state government to help with extreme heat? Are there any model policies or programs you would recommend to be replicated?
So right now, actually, and you said that I do a lot of things scale, so I've not kept on top of this, but I did want to raise this in people's consciousness. There is a bill that has been introduced to better protect outdoor workers from extreme heat, that I believe was introduced by Barbara Lee. That is being considered on a federal level. On a state level, I'm fairly certain that Oregon passed a piece of legislation after their terrible heat dome to better protect outdoor workers and farmers, specifically in Oregon. And I believe that there are a number of laws that California is considering to better protect outdoor workers as well, although I have not kept up with that legislation quite as well. On the other side, you have places like Texas that have actually stripped workers' rights in the face of extreme heat, which has just been appalling to see. They basically took away, their ability to have water breaks and shade breaks, which it's really hard for me to understand as a human being and as a physician what their thinking was, other than to save money.
Yeah, indeed. Therese has a question. I have heard health is a great bridge topic to discuss climate change, since it can cross the aisle and impact urban and rural alike. Would you comment, please?
Oh my gosh, it's like I planted you. So the consortium, the way the consortium actually came to be was based off of research exactly on that point. I am based at the George Mason Center for Climate Communication, and Ed Maibach conducted this research because he wanted to figure out, well, how should we talk about climate change to get people not just to care, but care about it in a nonpartisan way? And yes, absolutely, health. Health is the silver bullet, the winning argument. It is, and it is especially resonant with conservative audiences. So when you talk about climate change as a health issue, it helps to depoliticize the issue, and it helps to bring people on board. And if it's possible, Miriam, to drop our organization website, we actually have guides there on some messaging guidance on how to talk about climate change as a health issue. The most resonant way to talk about it is air pollution, because this is something that people can really grasp and understand.
Okay, thank you. We're not all pediatricians with white coats. So this question is from Megan. What role can other people, like businesses and business executives, play to become leaders in creating climate-resistant workforces?
So there's a big movement right now in ESG that unfortunately is facing a lot of blowback because of the culture wars that we are playing right now, that we are living right now. And so I would say if you are either an executive or you are at a company, If your company has not made ESG commitments to work them towards it, if they're facing blowback for it, then try to get as many employees to show your executive that this is an issue that matters. We actually have Gallup has done some data to show that for Gen Z, this is an issue that's deeply important to them. And so whatever the culture wars that are playing out right now, I think it's a very important argument for executive leaders to understand that this issue is only going to get worse. And if they want to attract top talent, they need to make these kinds of ESG commitments and stick to them. And then the other thing I would say is it's really great when these organizations can partner with, sponsor organizations like mine or others that are doing this kind of education and communications work. And we have a lot of opportunity. I recently have started talking to a couple of corporations that are interested in working with us because they want to change their investment portfolio to do more work in the climate space. So reach out to organizations that you think are doing good work in the space, in the nonprofit world, and see if your corporation can partner with them to learn from them and help them in their mission.
Thanks. Here's a question from Alan. Would there be more participation in actions to reduce the impact of climate change by not pushing the reduction of greenhouse gases and warming and focus on reducing transportation combustion products and providing resilience from heat impacts through many different strategies?
Can you repeat that question one more time?
Yeah.
Oh, I see it.
It's a long one. You got it?
Mm-hmm.
And or feel free to pull off one part of that.
Yeah, I mean, I think in terms of how we engage the public at large, I don't know that I think it's necessarily a sector specific issue. I think it's really just more broadly where we need to start is basically with awareness. And so I think health is one of the best ways to build that awareness. And then I think we can start talking about what those solutions look like. And some of this is going to depend on where you live, right? Because in a rural area, transportation issue is going to look very different than being in an urban area. What I encourage people to think about is that there is so much we need to change on climate change. What we eat, how we grow it, how we move, where we live, what our houses look like. There are many places where you can get involved. I don't think that there's going to be like one sector solution to this problem. Pick the area that you're passionate about, whether it's your schools, your buildings, active transportation, and then just dive in and start finding people and start working on it. I don't know that I think there's like one sector versus the other that's the best. The best sector is anywhere where you're willing to attach your effort.
Thank you. From William, how do health professionals effectively counter the deception promulgated by the well-funded multinational fossil fuel companies?
Oh my gosh, another planted, wonderful question. So, wait, which way? At our annual meeting this year, we are actually going to have 2 sessions devoted exactly to this topic. We understand there have been a number of industries with very well documented deception campaigns. So tobacco is one, the sugar industry is one, the gun lobby is not necessarily about deception, but the gun lobby has been quite effective at blocking the policies that we need to keep the population at large safe and healthy and basically to meet their bottom line. So these industries have all borrowed from each other for their playbooks, to basically prioritize their profits over our health. One that people just don't think about is big oil, but we now have very good documentation on what big oil has done to deceive the public, to stop the transition to renewables. And as a result, the state of California is actually suing big oil right now. 5 of the biggest oil companies, and it's the largest lawsuit that's been brought to date. And we as health professionals are looking for ways to add our voice to this. So our state clinician network in Montana actually joined the Held versus Montana trial. I don't know if folks are familiar with that. And this was really a youth-centered, again, going back to that point about the importance of coalitions. This was the youth story. This is the youth's fight. The health professionals were there to just add to their argument, to say that they are right. It is affecting their health. And I'm here to tell you why. I'm the expert on this, and I'm here to bolster their story. But anyway, if you come to our conference, you'll get more information precisely on that topic.
Good promo. And if you're looking at Lisa right now, you can see the info about the annual meeting coming up in February.
Yeah, and it'll be offered both virtually and in person. So you can join us online. Yeah.
Great. This question is from Carolee. People can get fatigue from daily public health messaging. What do you recommend in terms of messaging to ensure that people continue to pay attention to heat risks? And I guess it could apply to other risks as well, when they occur on across multiple days.
That is a great question. Unfortunately, we are in new territory here. And so I think I actually just last week, I was invited to present at this conference on risk of communication. And so I was doing some research on this, and the other folks were talking about HIV and COVID. And what I realized in putting my presentation together, there's a real dearth of communications research around these kind of slower moving risks like heat waves. So you ask an excellent question. I do not have a thoughtful answer for you, other than to say, if you're on a social media account or sending newsletters, I think just repeating the information. Maybe, again, we know that stories are some of the best ways to catch people's attention in a new way. And so if there are new stories that you can provide with the same information, I think that can be one of the most effective ways to catch people's attention for old information and make it feel resonant and new.
Yeah. Thanks. And I know we're getting close to closing, but I just want to build on some of your suggestions to us about taking action with a bit of a reaction. Some of us might not be feeling so confident in government and policy these days, and our own agency when we are sending messages to our representatives or trying to take action. Somehow you seem to stay uplifted and positive. What suggestions might you have for us on this to raise our motivation and encourage us to take action?
And this is very personal for me. I didn't become a mom until later in life. And as soon as I became a mother, it doesn't feel like a choice. It's like a switch that turned on. And I certainly have my bad days. Don't get me wrong. Like when that piece of legislation that we had worked on for 2 years didn't pass, it was very rough. We were all really sad about it and really angry about it. And I was like, Governor Newsom, how could you not want to protect children? So I don't want to give the illusion that I'm like rah-rah all the time. And part of it as a leader of a large organization, it comes with what I have to do, but I have my hard days as well. I would say find your community. That's the most important thing. And for me, I both have community and I have my kids. Like I do this for my kids. And so I just feel like I don't have a choice. I brought them into this world. And so I have to fight for them to live in a better world. It's not a choice.
Yeah. Well, thank you. And I appreciate it. And as a mother that has 2 children that are launched, I also know the responsibilities they're also feeling for this. And also I'm trying to absorb some of the blame they're putting on us for how we've gotten here. But yes, this is just certainly a challenge for across many generations to take on.
Can I add one more point to that? Is that I accept that blame. I accept that guilt. And so what I really try to do is to do what I can to lift up the voices of youth and work youth into positions of power as quickly as possible, because they get it. Our generation above, it's like wasting my breath. They get it. And so I want to accelerate them into positions of power as fast as I can.
Absolutely. I'm completely 110% with you on that one. I think we're about out of time, but I wanted to ask Miriam if there's anything, any housekeeping or anything, Miriam, that you wanted to share.
Just a huge thank you both so much. This was really fantastic. And yeah, we will get back to all of you with your questions. We can provide links after the webinar, and the recording will be available shortly. And we have as I mentioned, back in person in Sacramento coming up in 2 weeks, November 12th to 15th. Other than that, thank you so much for reigniting the fire under our rear ends today, and really, really appreciate you both. And thanks also to our wonderful audience and all of your excellent questions.